in today's Health Watch, knowing the difference between the stomach flu and the flu. It makes a big difference. Dr. Kevin Dahlman of Aurora Healthcare is here to explain. I guess the first problem is we've been calling the stomach flu the flu when it really isn't the flu.
Right, exactly. So it's a nomenclature problem. Yeah. So we're calling it the stomach flu, but really we're referring to the stomach virus when we say the stomach flu, which truly has nothing to do with influenza. It's a different virus. So with the stomach flu, what we see is predominantly vomiting, usually followed by diarrhea. You can have a little fevers and fatigue, but typically it's the vomiting and diarrhea that lasts anywhere from a couple days to 5 days.
So how would you treat that then?
So that's a lot of rest and of course keeping up with the fluid losses. So a lot of fluids. For little kids, we recommend electrolyte solutions. That's going to be important to make sure that all their electrolytes are in balance so they don't get dehydrated.
And just start calling it a stomach virus.
Right,
all right.
That's what we like to do.
The flu, influenza.
Mm-hmm. So influenza is predominantly an upper respiratory infection virus. So it'll often cause some congestion and coughing and runny nose. And then what we worry about most, Michelle, is that complication to influenza. So perhaps you've had fevers and fatigue for 5 days, cough and congestion going on, but then you can get a pneumonia. And with pneumonia, it is the infection of a bacteria in the lungs. Now, we think of the influenza as a virus. It is. But what can happen is it causes inflammation, so fluid goes into the lungs and then gets infected with bacteria.
Life-threatening.
It can be life-threatening.
So the treatment, the course of action for that?
So number 1 is prevention. Number 2 is prevention. Number 3 is prevention.
Oh, I hear the flu shot message coming on.
That's exactly right, Michelle. It is instrumental to get that flu shot. Certainly it doesn't work 100% of the time, but a little protection is a lot better than no protection.
But you're still dealing with this, the flu shot made me sick, aren't you, at the office?
Oh, yes. Okay. We hear that from time to time.
I'm glad you take it so well.
That's right. That's because I get used to saying this to patients one after the other, but that's okay. It's my job.
Yeah, it shows it's working, actually.
Right. So when you get your flu shot, you can mount a good immune response. And when that happens, you can feel a little achy, a little tired, and that's your immune system causing those symptoms.
All right. There are still parents who have objections for one reason or the other. What is your message to them?
Right. So what I would think about for those parents and actually find a kind way to say, what risk are you presenting to, say, perhaps some kids that can't get a flu shot? Say they have an immune deficiency or they've recently undergone a bone marrow transplant. Those kids can't quite get that flu shot yet. So that if you are carrying the flu virus, and in fact, Michelle, you can carry the flu virus without having any symptoms at all and then pass it off to somebody who could get sick. This could be devastating for someone that can't get the flu shot and doesn't have a normal immune system.
So bottom line, you're asking them to reconsider.
I would ask them to reconsider, but ultimately it's their choice. I make that very clear.
When it comes to either the stomach virus or the flu, another great thing, you got to wash your hands all the time.
That's the number 1 thing that you can do to prevent if you're not getting the flu shot. Wash your hands. Wash your hands and keep washing your hands.
I think we've got that. In fact, I'm going to go wash my hands after I post more information on our website at cbs58.com. Thanks, Doctor.
Thank you.